thank you, the organizers and all the partners. As the names were being read out of all the different organizations who've actually worked together to make this event a success, I couldn't help but noticing the word partner in all the names that you can see on the backdrop. So I think once again, if I can request all of you to give a big round of applause to all the partners who are not only sitting in this room, but thanks to whom the entire industry, least I say pharma industry, all the industries that we interact with on a day-to-day basis, all are partners who actually help us to move product. So can I please hear a resounding round of applause for all the partners who have made this event a success and who on a daily basis continue to help us to move product. Thank you very much. Now, this is the last topic of the day and we are going to try to make it as lively and interesting as possible. I'm joined on the stage by an extremely rich and diverse set of experienced professionals from different backgrounds. We have professionals who are dealing day in and day out on the domestic supply chain issues. We have with us a gentleman who's also a partner of the event, whose product actually moves the product, the pharma product, through the air. So we have a gentleman from Skye Air Mobility, whose product, I guess, over the last few years has actually revolutionized the way we move our products in the last mile. So that is the tech part of the discussion that we are going to be listening to today. We also have gentlemen from the pharma industry who look at the export side. And there are different challenges, different realities. So I can assure you that at the end of the next 60 minutes, we are going to have a very rich and informative discussion. Now to set the context, when we are looking at visibility into the supply chain, what we are really talking about is visibility into the inventory into the supply chain. And as we all have experienced over the last 3 years, the COVID and the pandemic shook us up from a supply chain perspective, but not only the pharma industry professionals, all other industry professionals, especially in supply chain, stood up to the occasion to make sure that the end consumer, or in our case, the end patient, is not deprived of the product. So once again, I think the pharma industry went through a lot of challenges and we will hear about some of these challenges in logistics that were faced by the industry and how the partners actually came forward to make sure that the goods which were stuck at different levels in the supply chain actually moved forward. So this was one extremely interesting learning from a COVID and a pandemic perspective. We also moved 1.6 billion vaccines across the globe during the course of the pandemic, and that's no mean achievement. And India is regarded as the pharmacy to the world, and I'm sure after the pandemic, India is also now regarded as the vaccine country, supplying country to the world. So great, proud moment for all of us to make sure that the vaccines which are made by us are actually reaching the patients globally. So having said that, when we look at the topic of visibility, once again, as I said, it's all about the product visibility. There is also information visibility that is something that is on top of our mind. So if we look at inventory visibility, let me start off with the panelist closest to me. Vikram, in your entire experience, when we look at inventory, ultimately the team of people in any organization which makes inventory available to the CNF or to the depot or to the stockist is the planning team. Because the role of the planning team is actually to make sure that whatever is the demand of the market has been communicated to our internal stakeholders and the product is moved. So in your experience over the last so many years, how would you say the planning role has evolved and what are some of the current challenges that you see in this particular function?
Thank you, Jevin. And Very warm, good evening to all the members in this hall today, and very elated to be amongst this, elite panel. And you talked about a very interesting point, how planning has evolved. So if I have to say supply chain earlier, if I have to say BC AD, before Corona and after the disease, the new Gregorian calendar, so to speak, So before Corona, supply chain was mostly about logistics, distribution, and was about procurement. Ki, you procure, somebody will produce what to produce, that somebody will figure out, no problem, and then you distribute. This was what supply chain used to entail about for a long time, But I would say not entirely due to Corona, but just before Corona also, people tried to understand what planning plays a very important role in doing all these activities of stitching together the entire information cockpit, so to speak. So I call the planners to be in the flying plane of a pharmaceutical company. And they are the ones who are getting all the information from different stakeholders, demand sensing from the market, from the procurement guys, I'm getting an idea about what my vendors are doing. From the logistics guys, I'm understanding how my logistics challenges are increasing. From the operations guys, I'm trying to understand what kind of operational challenges are happening. Because during pandemic, it was not just my logistics or procurement that was impacted, even my operations were impacted, because we had to make our own bio bubbles and make sure that we are getting the right senses, demand senses from the market, and giving my factory the right indication what needs to be produced. So the role of planning per se has evolved in such a stage that I would say even now, there was a news conference in which the President of United States was talking about the pencil supply chain, and he was talking about it's not just about where the pencil is coming from, where the lead is coming from, where the wood is coming from, which factory it is getting manufactured, how it's getting distributed. So that's the power of planning today that we hold. And I think it's time for supply chain and supply chain planning to hold center stage. We are at a very interesting phase, because talking about the topic we are going to talk about today, visibility and digitization, planning is going to play a very important role as to how we are going to interact with different stakeholders and take the right decisions. Coming to your second part with respect to inventory. So inventory is not just about finished goods, Inventory for us is also about raw materials. And we know as much as there is issues getting finished goods at the right nodes, globally or domestically, it was also a huge challenge for us to procure and have the right inventory of the raw materials. India is the pharmacy to the world. You said it right. India is the vaccine capital to the world now. You said it right. But we are still heavily dependent on raw materials, and about 65 to 70% of our raw materials are still getting imported into India. And during pandemic, we know what happened. Everything came to a grinding halt. Nothing could come out of India, and nothing could come in. India in fact became 30 different countries. Moving your goods from Goa to say Sikkim was a huge challenge itself. How do you move your goods across? So the definition of inventory in my mind has changed overall. We have started looking at inventory not just as just in time, but just in case. That's the new terminology that I prefer to use in our discussions. That what if A fails? What is the plan B? It is going beyond alternate vendor development just for cost initiatives. It is beyond cost now. It is about business continuity. So it's more about business, more to do with business continuity plans than business process re-engineering. So that in my mind has opened up a huge window of things that we can do in supply chain with respect to how we make our supply chains agile, how we make them resilient, and how do we make them sustainable. So that's my brief take. I'm sure we'll add a little bit more during the conversation, but yeah.
Thank you so much. So taking a cue from this, I'll jump straight to Vikas. So Vikas, you are looking at exports and imports for your organization, which is Indoco Remedies. And again, looking at the past 3 years, in the course of the pandemic, how did your organization deal with the inventory issues, and any kind of process changes or improvements you see today which were not there before?
Yeah, good evening, ladies and gentlemen. So I will add on to what Vikram and what you asked me that yes, pre-pandemic, systems is an inventory. Inventory is basically a business which controls and it gives you a customer service. So business is an objective. So inventory management is a big business objective which controls. It tracks and utilizes the inventory and it satisfies the customer. Since it is fragmented as a supply chain as a whole, and there are multiple functions involved to manufacture, I would say that as a manufacturing process, there are procurement department, there is manufacturing, there is distribution, there is warehousing, then there's LSPs, who deliver. It is all fragmented. Visibility of an inventory is very, very critical in terms of to take the business, and to recognize revenue. So you need a technology. You need a technology who can give you a visibility of all your products, component. Like if I have to define into 3 categories, I would say operational first as an inventory. Operation is not only manufacturing of a finished goods. Like rightly Vikram said, there are multiple components involved. It can be SFG, it can be raw material, it can be many other components which needs to be, have a visibility of what is there in my system, what is physically available and how much I can utilize so that I can service my customer. It gives me a business opportunity, how quickly I can execute, right? And that's how the business goes ahead. So that's operational. It also gives me all the visibility of where is the shortages, where I can control my inventory, how I can, because every inventory is a carrying customer, this value carrying cost. So there needs to be under control. Hence, as an operational, inventory visibility is very, very critical. Then I come forward as a finance point of view. Finance, what happens is that every inventory is a carrying customer. It's a value. How do I control it? So again, it's all cost of goods sold. So unless you have a less COGS, then the business value goes up. So very critical for as a business perspective, and as well as sales is concerned, because that's the inventory available, how quickly I can service my customer and how can generate sales and recover revenue from out of it. So critically important, hence visibility of an inventory, you need a technology. And if I talk about my company's perspective, so pre-pandemic, everything was fragmented, everything is on online. So we had a system, but yes, of late we have got into the latest version of an ERP where everything can be visibility to all the stakeholders involved into the entire supply chain. Hence, it definitely helps us to do much, much better than what we used to do before.
Thank you. Thank you so much. So that's a very interesting thing. I think one of the important changes which have happened in our organizations, we have seen a lot of technology in our personal lives, a lot of technology in our professional lives. And I think the technology which was probably sitting by the sideline waiting to be adopted, thanks to the pandemic, it got adopted much faster. Of course, it should have been adopted earlier. There was no need for a thing like a pandemic to happen to push us against the wall. But I think it kind of acted to, to really make sure that we get the benefit out of that technology. So having said that, I'll now move on to Rajeshwari. You've actually seen the thick and thin of logistics in your entire career. And can you share with us what kind of changes did you see in logistics and what kind of support you received from your team members as well as your partners, the logistic partners? And of course, during the pandemic, this whole question of visibility of inventory across different parts that you are dealing with or the markets you're selling to became very important. So how did you, face and grapple with all these issues?
I would say the lookout of SCM as supply chain or logistics changed after COVID. Pre-COVID, it was like the material comes, it moves away. It's very easy. But once the COVID started, it was like completely blank. Those who were the pillars, those who were considered as the leaders of the industry were not at all available. They were all completely dark. And they were the locals and those who were having the leadership type of quality who stood up to say that I will be the person who will carry on. I remember those days when there were nothing and the full truck loads were there, only FTLs, and FTLs also only few drivers were there who were ready to come up on the floor to do the work. And I still remember the roads were completely empty and the drivers are running the vehicle and they used to say, madam, मैं आ रहा हूँ और सिर्फ आपके लिए आ रहा हूँ और आप ऑफिस पे हो क्या? So we used to say, we are sitting for only the material and we are, you are also one of the person who is going to, help the needy people. And the first hydrochloroquine, when it was coming up from Siliguri, from Sikkim to Siliguri to Ahmedabad, we had the first charter. We flied it from Bagdogra to Ahmedabad. So later on, we started seeing that even the trucks are able to reach the next 4th day at Ahmedabad. And it was really great to those people who stood up during those period and those time period. We even saw that our inventories were stuck up at many of the standard, or you can say well-recognized organizations where they were not even able to come up to their warehouses. But we went literally to their warehouses to pull the materials, bring down, and it took several months though we were going to their offices. So I would really like to thank the entire logistics team from the fraternity, those people who came up, took away only these shipments and the carriers driving the vehicle transportations, saying that essential goods. And they used to say, hum aapke liye ja rahe hain. We also used to say them, you are one of the member who are going to save the lives, as we can consider that doctors kar rahe hain ya dusre kar rahe hain, वैसे ही आप भी एक important काम कर रहे हैं. So these were the major things that I saw during this pandemic. Moreover, if you see the team also, there were the times when they had family issues, where they feel everybody is sitting at home. I am not sitting at home. And we used to work like, one comes, one goes, one comes, one goes. But I'll be there in the office to show that, see, I am in the office and we have to carry on this journey because we are doing a very moral duty. And as an organization, as Zydus also, I would say that I was the only organization who stood up to make sure this moral duty of giving away the cost-effective way of medicines, which were very much needed during this pandemic. So it was a journey where we learned many things. We understood who can definitely do some challenging jobs. Post-COVID, the things are totally different. The main challenges which we faced till now also after pandemic and during pandemic also, that the reaches during the down in state levels, when you can say that from stockist towards the CFA to stockist onwards, the reach is a little bit not up to the mark that we used to see in the domestic market till CFAs. So we look forward from this fraternity to explore more on that region, to come up with visibility so that we can see much more things better, as we can see in the track and trace of other organizations are providing. So hope so that next time when I'll be coming here, I'll be able to see that more explorations are made in this journey also, to come up more professional people to come up for local distributions also.
Wonderful. Thank you. Thank you so much.
Thank you,
And on that count, just a small note, as we were discussing before, I think the whole mechanism of tracing the inventory CFA downstream, is really about using tech. It's also about using the field force, and it's also about trying to get your stakeholders to understand the importance of visibility, because no solution can be imposed directly, especially on a third party, because they have to see the benefit in that for them. So if we are trying to convince our customers that the importance of visibility is actually for them as also for the principal company. So I think the whole adoption of technology can be enhanced if we are able to create some kind of a win-win solution between us and the stockists.
As this change is inevitable, people are working on that with chatbot and all those things, trying to make up the change. But change is not so easy. There are many people who doesn't want to overcome with the normal things of manual things and all. But it takes the awareness only, can bring up those people up to the line and build up this chain of awareness to create and make sure this SKUs can help them, or this technology can help them in the daily routine. So it will take time, but definitely this change will come up, and it is in progress.
Thank you. Devdar Saab, to you, I just wanted to, so you are dealing with very niche products, basically cold chain products, and these are life-saving drugs. Two questions to you, sir, if you want to add anything to the current discussion from the perspective of your company, as well as if you want to take any parallels from some other industries, saying that if the issue of inventory visibility or the issue of inventory management, how have other industries stood up to this challenge and what kind of solutions they've adopted?
Good evening, and first of all, congratulations to all of you, all of us rather. Let the whole world go home. Logisticians are the last people to leave the hall. So I think we are living true to that particular spirit. We'll complete the job and then only leave wherever we are. Great discussion, and thanks for allowing me to talk about certain things which are parallel. It need not be exactly pharma, because it's always great to learn from somewhere else. While you were discussing, and Vikram was also talking about visibility, I think visibility, or rather inventory first, I mean, if it's one of those parameters which is like a vital as far as the body is concerned. If there's something wrong, you go to a doctor, he will check some of the vitals and say, okay, what is your pulse, what is the temperature, things like this. And then he will know probably something is right or wrong. Look at it in the same perspective with inventory. Look at inventory of an organization, and that's one of the vitals that anybody and everybody will be able to gauge the quality of management, the style of operations, your swiftness. A lot of things get together to make sure that inventory is proper. In terms of visibility, there are various dimensions of visibility. The speed at which the visibility is available, do you really require it online or periodically it is required? The kind of inventory, not just one inventory, but is it good, bad inventory, physical form of inventory at that point of time, or aging of inventory, or there are different dimensions of inventory or visibility which are related to that. So visibility is definitely, it adds a lot of value. So inventory by itself is one of the critical parameters, and visibility with different dimensions adds to that, makes it more interesting. In terms of the visibility, inventory, I think before COVID and after COVID, one of the narratives that has changed in most of the conferences that I'm sure we also must be hearing at. Initially, people used to talk little more about responsiveness, etc., etc. After the pandemic, it started changing to resilience. More of resilience than responsiveness that everybody started talking about. And the moment we started talking about resilience, one of the things that came in is again coming back to inventory, and it stopped at inventory visibility. You look at different surveys, different people talking about, they will say maybe tier 1 visibility is still good, but the moment you go to tier 2, it suddenly drops to a very drastically low level, and that's something which we obviously can't afford, especially in pharma. We just can't afford to do that. So, I mean, the topic is great, really wonderful to have it on this. Secondly, as you said, there are different people, different industries who operate at different levels of visibility. So maybe I'll just try and get something outside of pharma in that sense. So I was hearing to this experience of Tata Steel, one of the conferences, wherein those guys, coal is a very extremely important product for them. It adds to almost, I think, I don't know, maybe 20, 30, 40, 50% of their cost. It's a huge factor in their entire cost structure. And if they miss the timing of buying coal by maybe a week, it can mean a few 100 crore rupees for them. So it was an extremely vital factor for them. What they did is, in terms of getting visibility, they set up a data analytics engine with almost 5,000 data points, and they started tracking all those points and making sense out of that and deciding when to buy coal. I think that's one level of inventory, one level of visibility as to what are all those factors which are affecting you, and based on that, what decision should I take and when should I take that decision. There was another level of visibility, dimension of visibility which I heard, Anderson Hauser. They have a factory at Aurangabad. So when the inventory level goes down at Anderson Hauser Aurangabad factory, there's an automatic sensor which senses that. They have a contract with the German partners. A message goes to German partner, it goes to DHL in Germany, DHL goes to the partner, it picks up, inventory is replenished. That's another dimension of inventory which is accessible or available to them. In one of such conferences couple of months back, some of us were also there, I can see in the same conference, there was one of the quick commerce player, he was explaining his case study. they deliver it under 10 minutes. Anything deliver under 10 minutes. And the level of visibility that they have, it's a very different dimension. He said out of all their 180 stores, dark stores that they operate, every minute by minute, they have predictability and visibility in terms of what are the orders expected, what is the traffic condition, and hence what is the rider requirement at that point of time. And then the engine decides to take certain actions, including what rest and when the rider should take what rest. I think that's a different level of inventory visibility as well as the visibility in terms of the operation that is required. So just to cut it short, I mean there are various industries which are operating at different ways in which inventory and inventory visibility is making accessible. There are parallels which can be drawn within and learning which can be taken. I just want to share maybe one more example if you have. See, I heard another interesting example. There is an organization which runs an MRP engine, and after an MRP is done, they have got excellent partnership with their entire vendor base. So they publish their MRP results to everybody. People come back to them within an hour or 2 hours. Once they come back, they do an adjustment and then release the orders. Naturally, they operate at an extremely high level of OTIF. That's another dimension of inventory. So there are various dimensions of visibility and inventory that people work with. Having said this, technology, I believe, also should not be used for the sake of technology. That no, I am tech savvy, you have a digitalization. It is to be used in a very appropriate manner. Maybe more we can say it a little later. But before I close, I also want to say that beyond technology, it's also important that go to visit things and see it for yourself. There was a type of tracking that we were doing for some of our cold chain shipments. It was not in India, outside of India, and we were somehow getting temperatures were going much below our expected requirement, We saw the entire data, everything was perfect. Finally, we requested one of our representatives to go there. He gained access to that airport, went inside, saw, and for those people, they had no sense of differentiating between 228 and minus 20 degrees. We were shocked to know that one of the international airports, they were not able to distinguish properly. Somehow our 228 cargo was getting into minus 20, and that's how we were always seeing some kind of a dip, which we couldn't explain by other way. I had myself seen at Bandra station how the cargo is getting loaded into a train. They have a wagon full of cargo, dedicated to cargo, 23 tons to be loaded in I think about half an hour or 1 hour 45 minutes. The way they handle cargo, it's amazing to see how beautifully we pack our products. Nothing happens to them despite all the rough things that happen at that level. I think this is not captured by technology. This is something which we need to have on the ground presence. So technology is important, visibility is important, technology is important for that, but then a right technology blend with online support is something which can win the game for all of us.
Absolutely. Thank you so much for that. And on that note, I just want to add a couple of things. It reminds me of the fact that one needs to really go out there. And in the break, I just thought of a comment that I heard from one of our colleagues here, that her previous boss used to actually tell her that you can't learn journalism by sitting in the office. You need to go to the warehouse and you need to see how the product is packed and moved. So I think it's extremely important, like you rightly said, that one must understand the need for technology. And what example again came to mind when I was listening to you was the very first case of inventory visibility, if I'm not mistaken, was between two large American organizations, P&G and Walmart. So I think this is almost 60, 70 years back that both these organizations, P&G and Walmart, extremely conscious about inventory. And and Walmart was known for, at that time was expanding very rapidly, and hence a large chunk of a retailer's investment is in inventory apart from real estate. So there's a lot of investment in inventory because someone like Walmart is holding millions of SKUs. So what P&G and Walmart actually decided to do, so their problem was that they were not getting the orders on time from Walmart, and their ability to replenish was hence delayed. So they came upon a very simple solution. They said that on a daily basis, each store of Walmart will share with P&G all the stock levels of P&G products. So all Crest toothpaste, whatever products P&G had at that time was being sold in Walmart. Walmart would share on a daily basis the stock status. And it would be the onus of the nearest P&G warehouse or depot. As you rightly said, if it goes below a certain level, it will create a STO, stock transfer order. So then that nearest depot would then supply to the nearest store of Walmart. I think if I'm not mistaken, this is one of the earliest uses of inventory visibility and information sharing. Sure. Thank you so much. So on that count, we will move a little bit more on the cargo service side. Pramod, can you share with us how technology has been used in your organization and what kind of benefit did you see when the Turant app was launched?
So good evening to all, and happy to be here, speak this evening. Yes, so we did a little bit of learning like Rajeshwari spoke during COVID. So all this happened during COVID. So we got a lot of questions like, when is the truck going to come? Is my cargo there? Airlines had questions like, has my cargo arrived? Can I plan it on a particular flight? The forwarders curious, has my truck arrived? Has it got custom cleared? Has it been screened? Is it ready to be uplifted? The shipper on the overview wanted to know where is this cargo because it's left from his manufacturing unit. He's not sure whether it's on the way, is there a tire puncture, or is it reached there, is it waiting in the line? All those kind of questions. So all that thing got us thinking, and information is what everybody was seeking. It was there. Each one had the information. The trucker had a GPS, and the trucking owner knew that his truck was here. We knew what was happening in our terminal, and we knew it. The shipper knew, okay, it's departed from here, it's due to reach Atlanta and so on, so many days. But where is it on the way? Not too sure. Freight forwarder knows the cargo has landed, but is the Leo given? Is the document cleared? Is it been screened? Is it held up because of some damage or some DG issues or something like that? So taking all this into account, we had a lot of meetings with the stakeholders, and the airport itself has a wonderful platform where all the stakeholders, it's called AMAX now. So all the stakeholders get milestones. So we just added on to that and we created this app called Turant. Now what Turant does is, in short, the moment your cargo or your truck arrives at the terminal, from that point till your flight departs or the cargo departs on that flight, it gives visibility to anybody who has the available number. It's just a simple app. It's on Google. It's available on Google Play. You download it, register once. And the moment the cargo arrives, it tells you it docks in at a particular time, your cargo is offloaded, your cargo now is ready to be accepted. Now it is accepted, and then the moment you get the cargo custom cleared, you get the Leo number. It's all visible. But today the freight forwarders don't log into iSkate. They look at Turant. They say, okay, now my cargo. When he's sitting at home, probably having lunch or something, and he just looks at his phone. I mean, everyone has a phone today, right? So he just logs in there, he says, okay, this cargo is cleared, now I get my documentation, I submit my documentation. The moment the documents are submitted, the airline gets an alert, your documents are submitted, cargo ready to be uplifted, plan it on a flight. So we made that real time. Earlier, we used to get all the cargo together for that flight and then send information to the airline. Today, it's on a real time basis. The moment the cargo is cleared, it's ready to be uplifted, the airline, the sales team, as well as the planning team, gets an alert on email besides logging onto their system that your cargo is ready, plan it, and it can go on this flight. It can go on this flight and not on the planned flight because it's already ready. So you don't have cargo for this flight, take it here. So you don't want your flight to be empty, right? So you have that option today. That's what we're giving our customers. And this is at no cost. It's just an edge, it's an added value add service that we give them. It's palletized, and the moment it's palletized, it is released from our terminal. The forwarder knows, okay, the cargo has been released. It's uplifted. Again, this is uplifted on our system, and it takes off. So this visibility has been provided by us, and it has been accepted, and a lot of airlines have improved their planning. Today, they can plan real time. Earlier, they used to send us a load sheet 24 hours before. They do send it to us today. But now, as and when they get information that your cargo has arrived, the planning keeps changing. It's very dynamic. That is an effort for us also because we are planning our resource as per the 24-hour list that has come to us. But suddenly there's dynamic change. So we also have planned our rostering and our staff and our resources accordingly. And now we are using data analytics internally to actually analyze where the cargo hotspots are for us. Like, I know weekends, before public holidays, there are certain days that there are certain freighters going. What are the volumes I can predict today and plan my roster already? My roster is just not planned on a regular basis. I might have 12 guys on a shift this week. There might be 14 next week because I've got freighters happening. So that's the use that I have put the technology as well as the data that I have. This also helps me sort of move, like you're talking about inventories. I actually don't have inventories. I don't like inventories. It's expensive. So for me, it's throughput. The more I push across to my terminal, the more money it makes for me. So that's what we do. So we plan accordingly. We know the trucks that are coming in today. We know when they're going to depart. And that's how we move the cargo quicker or hold it on with us. So our resources are planned accordingly and they're utilized and optimized. So this is what Turant is all about.
Fantastic. Thank you so much. So I'll take one cue from here. I think you hit upon a very important point, Pramod, which is the relationship between inventory and throughput. So, I mean, the less inventory I have or the more inventory I move, the higher is my throughput. So, if we in supply chain came to regard inventory as a necessity, but in many ways inventory also as a liability, then I think our focus will shift from inventory to throughput. And that is what will help our organization. Of course, there is a sales team which is responsible for generating the orders in the first place. But once the orders are generated, the speed at which we can generate throughput is entirely up to the supply chain or the back-end team. So thanks a lot for that. And we'll now move to one of the most, as they say, yes, please.
Can I add on this
please.
point, like
Yes.
what you said, that inventory visibility until it is finished goods. Once it is at the finished goods is ready and it is in the warehouse, for us to execute, as a logistic, we need to execute, and of course throughput is very, very critical. How much inventory you are keeping so that you can execute your shipment. So inventory visibility from manufacturing, from procurement till manufacturing, till the FG is ready, then throughput plays a very important role.
Absolutely.
How quickly you move those cargo.
Absolutely.
Because that's how you generate revenue and that's how you repeat your orders. So very, very important point.
Thank you so much. Thanks for sharing that. So let's hear it from the inventory movement gentleman here. The last mile, if I may say, and a very revolutionary way, a new way, if one may say, and probably, not probably, definitely a more time-saving way of transporting good. So let's hear it from you on how, in what scenarios or in what case studies have you seen the adoption of drone technology? Can you share with us a little bit about the use cases over the last couple of years? Again, anything special about the pandemic that you want to add in terms of how it was used to, how the drones were used to move product again? Over to you.
Thank you so much for this lovely opportunity, as today I come to know a closer view of how pharma industry and the logistic integration is working and discussing the challenges and how to upgrade and integrate newer technologies into the system for betterment in future. As we have been always now post-pandemic, we correlate everything, all our discussions, right, starting from pandemic days or, the challenges what we faced during pandemic and how we have, upgraded ourselves or prepared ourselves for future.
Yes.
Overcoming the challenges and taking experiences. So pandemic has helped many industries, I would say, people who really utilize that time in upgrading and focusing on future technologies. At Skye, we concentrated and focus on what could be the future tech and applications and how we can, bring in this kind of disruptive revolution of logistics management through drones. And fortunately, we have got an opportunity to associate, and we find a lot of confusion happening that drones, is it a reality? Is it working? How far we are from the real-time deliveries or logistics management happening through drones, because we have a lot of solutions right now available, the road logistics, the sea logistics, or even air cargo management through flights, everything. But through drones, there is a bit of confusion. But fortunately, with the support, right support, I would say, India is the first country to have such kind of acceptance to this revolutionary technology by the government coming in support, the policy getting relaxed in a way where we can really visualize ourselves as the global hub, drone hub, as our PM is visionary that India will be a drone hub by 2030. So taking that vision into our adoption, we have really seen the acceptance of this industry, right from government as well as private. We are now, just to throw light on how the acceptance of this technology and what role it could play in a larger perspective in future. We are operating now in with Himachal government as exclusive drone partner logistics. We are handling again with healthcare system, like we are connecting 2,900 pods there. That kind of network we are creating for government, where we will be handling all medicines, healthcare applications, and vaccines from hubs to spokes and different PHCs throughout. Similarly, we are working with a lot of private companies. I would not like to name very specifically, but we are associated with a lot of leading healthcare companies right now who are into pathological labs, handling their blood samples from to the testing centers. We are creating that network. We are also working with the aggregating companies who are working with a lot of pharma companies who are, by connecting to the pharmacies or their warehouses. In recent times we have established a beautiful POC we have conducted for say 3 weeks with one of the eastern regions of India, where one of the top leading pharma company, distribution company, we are working with them and creating now the actual commercial deliveries are going to happen in very near future, which will be known to the industry that this is the way drone technology can really come to a reality and help, by and large, so many solutions in real time. Not to just restrict, of course, I'm talking more on pharma application or healthcare specifically here, but drone tech in real time is a technology where we are trying to create a parallel ecosystem, I would say, in Skye, what we are normally already experiencing on road or sea. We are creating a parallel ecosystem getting built for day-to-day needs, basically, for last mile or first mile deliveries.
Fantastic. So Shrikant, I'll ask you a few more questions, especially with regard to some data points. So for example, in your experience, what has been the impact on lead times when it comes to the advantage of drone over surface transport?
So let me put it up in a very layman language that, the routes established by road transport or road logistics have a lot of challenges, not only from the distance point of view, but congestion point of view, and the challenges what we need to encounter. So with drones, we can actually create a aerial logistics and aerial path, which is free from all these congestions and challenges. So naturally, it helps in the very clear path what we design. Apart from that, it also helps in much more challenges to get reduced. So by and large, in a layman language, it reduces more than 50% of your time compared to road logistics. That's a normal layman kind of an understanding. But when you deep dive into it, you will find great value engineering when you use, aerial mobility compared to the road mobility.
Right, right. All right. So again, the last question to you on this particular account is the adoption in general. These are early stages, and what are the factors that you think will greatly aid the faster adoption of drone technology, especially for remote areas where there are lack of access is probably one of the challenges there.
So I'll tell you a little, one of the use case, maybe you will draw or connect the answer what you are looking at. Maybe, many a times we are stuck with certain things like we create specific green corridors for say organ, transportation from say airports to hospitals where it is so high priority activity. So green corridor is, to say it's very simple or simplified, term, but to undergo a green corridor management, it takes so much of permission, so much of, planning, strategic, thing, or a lot of coordination is required. And when you, when green corridor is created, we only restrict this planning to city areas. When you think about rural or such kind of remote areas to get connected where there could be donors of organ, but we cannot handle that right now because there is no green corridor creation for a distance say 100, 200 kilometers. Yeah. So imagine this kind of technology which we are actually talking about, drone. It can handle and create an air corridor which is free from any kind of all this big planning required when you talk about green corridor creation. So we can connect 100, 200 kilometers very easily with drone tech, and we can handle it in much more faster way and much more useful way as a technology integration. So I foresee, from a standpoint where already there is a big acceptance what we have actually seen. It's hardly, we have formed our company in 2019, but real-time execution has started from, say, 1 year down the line now. Within this 1 year, if the acceptance can be this, we can clearly see that it's a disruptive space where we are, seeing a lot of acceptance from all areas. Pharma has not yet started off, when it comes to pharma companies, I would say. We are already, playing our or maybe we are a leading player in the space of healthcare. But of course, with pharma companies, this is one platform where I would like to draw attention of all that. You should actually try to look upon, doing a test kind of POCs within your system. Maybe this logistics new space, new technology would help you in a better way, in better solutions.
Right. Thank you so much, Shrikant. So, so I think with that, we will, I think we would have covered a lot of interesting topics in this particular panel discussion. We spoke about inventory, we spoke about visibility, we spoke about the role of logistics and our partners who helped us to move product during the pandemic. We spoke of the importance of planning, because I think that's where the entire supply chain system really starts, and not just planning of finished goods, like you rightly pointed out, Karthik, it's more about raw material planning, PM planning, as well as finished good planning. So I think that's been a very interesting, diverse array of subjects that we have covered, and what we can probably do is open the floor to questions. You can ask the question to any of the panel member, and or if you have a generic question, then one of the panel members can stand up and reply. Yes.
We are talking about synergies here, right? When you talk about inventory, and then you're talking about these timelines that it has to follow. Generally, and this is so many years in the trade, we generally write an email and ask, what is the readiness of goods? And we get to know, okay, fine, this particular date, it's ready to move. And the urgency around starts getting created. Can't we go one step behind and do reverse working? Is that being done? That's my question, because how goods are produced, we don't know. But certainly you would know the production timelines. Can we go 1 week before, 2 weeks before? Because I understand these technologies are coming in, and I'm not too sure how expensive they are going to be. And I'm sure trucks will still be here. There are going to be other modems which will still exist, so they will not vanish. So production, how it's done, we don't know how goods are produced. But can we do the reverse working? Is there any model being followed as of now with any of the organizations, anyone here?
So can I take this?
Yeah, please.
So yes, you said as a pharma company, there is a systems in place. So when there is an order from a customer, there's a reverse planning is done. The planning is done in such a way that the production planning is one, the procurement lead time is one. So put all together, if I have to just say in a number for a pharma product manufacturing, the lead time is around about 45 to 60 days from the procurement till manufacturing. And of course, the logistics distribution is adding to that. So what the system, what we are trying to create is that all the orders, we have an ETA for the customer, ETD for the supplier. So that has been tracked and mapped, and we do reverse calculation. What can be serviced in this particular month, right? Of course, it's a complexity. There are so many complexity in terms of procurement and manufacturing, because there is a quality aspect which is very, very critical. You cannot bypass quality. Hence, most of the material, if you see, it comes on the month end, and hence everything gets clocked together. But yes, that's the cycle which happens. But yes, we do calculate that there is an ETA for a customer, and we do a back calculation, and that's how the production has been planned. Scheduling and planning has been done. So for sure, these are there. But then, because of the complexities of the product manufacturing, nothing comes on dot. There's always something which is backlog. Hence, there's always rush hours. So as a pharma or any other industries, probably this is the trend.
So if I may add also, for us, like we follow ATP, available to promise, so to answer your question, a lot of detailing happens to the last hour, if not to the minute, So we have getting, at the start of the month, we make the detailed plan of what needs to be delivered, what needs to be planned. Do we have materials to add to what Vikas was saying? Do we have material available with us? Are they tested, released or not? And we do detailing day-wise scheduling. What will be the changeover times? What will be the readiness of the material when the quality will release it? But like he said, we are in a heavily regulated industry. Any deviation, any small deviation means that quality perspective has to be relooked into the entire product flow, where the product could go wrong or is going wrong. And because pharma industry does not believe in Six Sigma, every pill that comes out has to have the same efficacy and effectiveness, because every drug that a patient takes could be a life-saving drug for that patient. I cannot afford to have, out of 1 million, one drug which is not effective. That one drug could be going to a patient who needs it at that point of time. So given that constraint and given that regulation, yes, there are slippages that happen. But to answer your question, we do that detailing, planning, and available to promise date is ensured that we adhere to. And that is where supply chain, operations, logistics, all these cross-functional teams sit across in the same room and work on a very closely knit S&OP process in which we understand what needs to be delivered, what my market needs, what is the best case I can deliver, what are the dates. And my logistics teams works with service providers, logistics service providers, freight forwarders, to make sure that we are getting the requisite logistics tied up to move the shipment in the best way forward. So yes.
Yeah, thank you so much. This was to know you all better. The fact that when I spoke about synergies was also that transparency begins generally with freight forwarders, like, okay, goods received, what next, then what next, and what next. Generally, it doesn't happen the way that there are systems that they are giving us information within our teams that we are ready for it, Generally, urgency starts when goods get ready and we get our first booking. So the idea was to go one step back, but I understood from your perspective and appreciate it, because the more we know our customers, the better we'll be able to serve.
I'll add on to it. Besides the SNOPs, we do have shorter tracker meeting also. the mid of the month, just to understand what is the shortages that is going to happen and what is the demand in the market. And so as the FG produces, there are ways where even on T1 release, the shipments are moved. So it is all sudden, all changes keeps going and ongoing. And we would also look forward at how fast we can hand over. So these things keep on changing as the market scenario or the demand comes up. So it's a change that none of the place you can see that the transparency is not there. It's completely a tie-up collaboration between the planning, the supplier, the demand team and the logistics that runs to make sure the availability. We have availability for a weekly basis also on 10 monthly basis. That is 10, 18, 23. We have this type of milestone which we have to keep up at par to meet the requirements that has been placed by the market. Hope I'm able to give up the answer.
Yeah, you've been able to give me my answer, so thank you so much.
So
The idea
in addition to that,
sure.
I'm sorry to interrupt. So if I talk about our company which I come from, we give a planning in advance to our service provider that in this month, this is what the plan is. Probably giving you a little heads up that this is what is going to come throughout the month. So we give that visibility to our partners who then create the availability of the inventory and then they move. So that's what we follow.
Sure. Thank you so much.
Just on a lighter note to answer to your question, madam, God has been delivering billions of babies in 40 weeks, but sometimes those dates are not exact. We are just humans. Okay, so there are two questions on technology. Why are we not able to access or leverage inland transportation, inland waterways and cabotage in India? Because that is one of the cheapest and the less polluting method available. And we have a very huge shoreline and a lot of inland rivers where we can have inland waterways.
So again, please.
Yeah.
Please go
I
ahead.
mean, the logistics lead.
Logistics
so
team,
I'll
yes.
add here, yes, we are exploring these possibilities, but yes, the availability and visibility should be there because it's pharma. So if I have to just give an example, we were discussing last month that there is something, which is operating as a barge movement from Goa to JNP, but where is the feasibility? How we can ensure that it can be delivered, it can move. So again, there are challenges. Once it is available, then we are definitely open to explore those possibilities.
Yeah, and I'm not sure how closely linked it is to the infrastructure. So it's not just the waterways, but also the infrastructure around the waterways. So I think that's another.
So, and to answer your question, I mean, if it is about innovation in logistics and distribution, I think we are there. I mean, you talk about, during the pandemic, I think Surendra was talking about using, SRR, rail freight. I mean, we started using rail freight. We talked about multimodal. I think I was talking to somebody about multimodal just outside, So we are starting to innovate. Gone are those days when we looked at, okay, my cargo is ready. It has to go in the container. It has to, come from point A to the port and it will go to the point B. We are looking at different ways to innovate because innovation is coming from cost, from availability, from the speed that we need the products to go there. And definitely, inward, domestic waterways, when the infrastructure is ready and there, I am sure
Yes.
pharma companies are up there because now we have real-time visibility with technology. We have, access to technology to track, monitor, look at temperature excursions, also look at, where counterfeiting can get into your supply chain during distribution. So a lot of these issues or risk associated with moving pharma goods have been addressed. So I'm sure there is no two ways that are stopping us from exploring these new ways also to distribute.
Just to add, we are also there to support your
Of course,
plans.
of course. I mean, definitely. And I think with all the e-pharmacy coming through, I mean, drone technology is there to, support the last mile delivery in a tremendous way. You put it rightly. Yes.
Yeah, hello. Hi, Deepak here. I have a question for the panel. So, just like, in the financial sector, we see a disruption which happened via the UPI, which is Unified Payment Interface. We now foresee ONDC coming to the market, which is Open Network for Digital Commerce. So, how do you think, in coming years for pharmaceutical industry, Is there going to be any impact, and just wanted to know your views on that.
Would you like to probably elaborate the question to a more specific point?
Yeah, so
Yeah.
just like in the financial sector, you know, we
Yeah,
see a major disruption which has happened through UPI, QR code scanner, we can just make the payment. So there is a project which is headed by Nandan Linkini, similar to what they have introduced for financial sector. They would be introducing for digital commerce also, which is open network for digital commerce. So I wanted to know how do you foresee and what are your views, how it will impact the pharma companies? If you have heard or read about it, probably you can answer that.
Frankly, it's like not just pharma industry. I think it will also, ONDC will create a phenomenal platform on which the buyers, the sellers, the logistics service providers, the payment gateways, everybody will get onto that particular platform. So not just pharma, I think any industry which is operating within India, they will be able to make use of that. And you've seen a lot of e-pharmacies getting into the market within India. You see a lot of, let's say, companies, even Shrikant made a reference to pathology labs. So diagnostic companies are building a whole infrastructure or whole chain of their own. You will see whether it is Tata's or Reliance or anybody for that matter, they are looking at manufacturing, distribution, the last mile connectivity with 1mg, everything is getting together. So those are, let's say, private gateways or private highways which are getting created. Instead of that, it will become a universal platform for everybody, and I am sure pharma will definitely be able to take advantage of that. You will have far more choices. Today we have limited choices, you will have far more choices. It will obviously take a little longer time to mature.
Yeah, hi Aditya here. So I have two questions. First is I am vertically involved in the CFA distribution and retail process of the Pharma Logistics. So I wanted to know insights from you, like Pharma Logistic managers are interested till the PO is generated, like we get an order from stockists and we generate a PO, we generate an order at CFA level. But after that, there's minimum digitization at CFAs. Like all the manual work is going on, no use of barcodes, RFID, QR codes. So like what are the logistic managers at the pharma companies looking at this issue? And the second question is, as the modern trade is growing, like 1mg, all the online aggregators for the pharmaceutical thing. So how are you planning to set up the supply chain for this fast growing pace? Like will the distributors, the channel partners will be affected in this process? Thank you.
Yeah.
With regards to the traceability, or with regard to the traceability that we are looking forward from stockist to CFA to stockist, there is something which has been worked out in our organization with chatbot and all, where they will be putting the IT into implementation so that this visibility of getting whatever the orders being punched and the visibility of seeing the shipments will be coming up, but it will take some year or two. Moreover, as I had said in the same during this discussions, that in terms of logistics, we are looking forward for, because the local who are serving the state level from CFA to stockist is yet to come up, because they are not going in down the local localities. Where if you see the service providers like couriers are working or they are not working, but still that the old religious method of going from transporter and transporter is still serving the stockist, which is yet to come up with digitization, which I have raised in this platform also, that some more service providers should come up and take the lead with tech and with more professionalism into it, because it is still the same religious process being followed since years.
Yes, I would also like insights from Vikram sir from Sun Pharma, like if I can get some insights on this.
Sure. I mean, see, visibility is definitely, the more you get, it's better, but right now with whatever technology we have and the infrastructure we have with our CFAs and our stockists, there is a limitation to it. But what I feel is with serialization and aggregation, probably we'll cross that bridge. I'm with a lot of cloud computing and industry 4.0 with blockchain, etc. This information flow will become easier. So you can be working on a different system or ERP, and I can't be working on a different ERP system, but the information exchange will start. And I think we are at the cusp where we'll start looking at these technology aspects to bridge that information gap. And like I said, to start with, I think when we start aggregating, serialize and aggregating it, the moment we start scanning those QR codes, those barcodes, those serialized codes, which is going to be mandated on every carton or every strip that goes out in the pharma. There's a government mandate coming now. The QR code has to be there on each pocket, So we are starting to look at, so it is all going to help us enable that technology, and not just the stockist level, it will take that visibility to the patient level. So not just how we are going to monitor what my stockist is selling, but it will also enable me to understand how my patient is getting prescribed and taking the medication. So end to end, I would say it will be visibility across the patient life cycle management, not just the stock movement that you are talking about. So in my mind, in the next 3 to 5 years, we are going to see a huge change in terms of how technology plays an important role in enabling the entire patient life cycle management, and especially with new channels of distribution like 1mg you're talking about, e-pharmacies coming about. That is just the tip of the iceberg. We are going to start from diagnosis to prescription to medicine delivery to insurance, everything in one big platform, which is going to enable doctors, insurers, service providers to come on one platform to make sure that the patients are going to have a healthier and a better lifestyle. That's the picture I am looking at least.
Fantastic.
So maybe I can add here, because domestic distribution is, the model is like you have a distributor, lot of CFAs, it's too much fragmented. If I have to give you an international flavor, there are very limited distributors. So if I talk about, say, regulated market as the US, there are only 5 big distributors. You supply to them and then they take it to the last customer.
Yes.
There is a visibility. So then they are connected to our ERP. We can tell you, or they can tell us that where your product is lying, whether it is at the pharmacy level, but there's a visibility is there. In India, it's too much fragmented. We have got n number of distributors, n number of CFS, individual organization. But as a regulated market, as an international, there are hardly 5 in US. You have to supply to them and then they take it forward. So that's the difference. I'm sure by aggregation and serialization, this is going to come up soon. But yes, we have to abide with this regulation. And then definitely in a couple of years, we might land into the same situation that because of serialization and QR code, we will be able to track and trace till the last level, till probably at the pharmacy level.
Sir, revisiting my second question about the increasing in online aggregators, like what will be the effect of increase of these online aggregators on the existing channel partners, like the distributors, how you will tackle with the supply chain strategies of your company?
So tremendous. In my mind, it's tremendous. Like I was going to tell you, I mean, it's going to change the entire landscape of distribution going forward, in my opinion. The way we look at distribution today, the way we work with CFAs, everybody will have to, unlearn and relearn and, learn a lot of new things as to how we move goods across, from our warehouses, not just from our warehouses, from our factories to our warehouses, because a lot of new concepts like dark stores, are going to come up, and with a lot of, ease of regulation, how we are going to store goods over there with a lot of disruptive, supply chain technologies, distribution technologies like drones. We talked about multimodal, etc. It's going to completely transform, and the focus of all this transformation in my mind is going to be patient health. How and when my patient is not going to get deprived of that critical life-saving drug is going to be, the driving point of all this change. It's going to make access to medicines easier. we talked about, not just, the metros, we are talking about rural and remote areas, how this technology, how aggregators are going to make sure and have real-time visibility with respect to making sure that the critical goods, not just in metros, reach to the patients even in rural and remote areas. And that is where I was talking about the entire patient life cycle management through a digital platform. So it will start right from getting diagnosed through your smart devices, through your smartphones or etc., where the doctor is going to prescribe. So a lot of real-time basis, your distributors will come to know that, okay, this patient might need this medicine, so how we can, from which store we can look at, it's going to be the Amazon or Flipkarts of how we do our shopping right now. When you go to Amazon and you click something and you put on your cart, it gives you a date, right, when it's going to get there. So that's a lot of aggregation that is happening on the background. That's the same technology that's going to happen with, medicines in my mind, and it's going to be a very exciting next few years in the entire supply chain management of pharma, in my view.
Thanks, Vikram. So I just wanted to go back. So are you a distributor as well, the person who asked the question? Yes, sir. Yeah. So I think what Vikram has just described is that change is the only constant.
Yes. Unlearn the thing and upgrade yourself.
Yes. So you need to decide, where do you fit into this new ecosystem? It's up to you. Like Vikram has superbly described what the future entails.
Yes.
And it's for you to decide that if this is going to be the future, and anyway, it's not going to be 100% of the market is completely going to be online, right? So there is going to be a vast majority of sales which are going to happen offline, another growing majority of sales which are going to happen online. I think it's for you to decide.
Yes, thank
where
you.
you play a part. Yes, sorry.
Till CFA, no distribution network is going to change in India, at least in the near future, because no pharma company is selling to online retailers directly. We are not allowed to sell, right? These are the distributors only who are selling to online pharma. And this, who sells to the distributor? So that is the CFAs. So if your question is whether my job as a CFA is safe, it is safe. Don't worry. That is one. Second thing.
Not my question. I know CFA is safe.
Yeah.
I wanted to know the effect of this modern trade on the distributor. The small distributor at a very small town. Like what will be his life in the coming future?
Let me just address to that as well from technology perspective. The only way to be safe in today's world is upgrade yourself with technology.
Right.
If you are ignoring it, then maybe definitely you will have that overcoming effect by somebody taking over to you. So that's the reason we are here with different disruptive technology. It applies to all. It applies to everybody, all of us. You have taken initiative to be part of this technology upgradation, summit. That's the way that we should be ready for the change.
Yes, thank you.
So thank you very much. I think it was a very interesting panel discussion. Thank you for the questions.